America's hospitals, where miracles happen every day, and where some doctors manage to do things so dumb it's honestly a miracle anyone walks out alive. From surgeons who mixed up body parts to nurses who turned people into chemistry experiments, these are 33 of the dumbest medical mistakes in American history. Real patients, real disasters, and in most cases, completely avoidable. Let's start the operation. Number 1. A Texas neurosurgeon named Christopher Dunch thought he was the next medical rock star. His nickname? Dr. Death. Between 2011 and 2013, he wrecked spine after spine, cutting nerves, leaving screws loose, and paralyzing 33 people. One patient woke up unable to move. Another never woke up at all. And the wild part? The hospitals kept letting him operate. Turns out, the only thing he was good at was convincing people he wasn't terrible. Texas finally threw him in prison for life. They should have just revoked his ego. Number 2. In 2003, 17-year-old Jessica Santillan needed a heart and lung transplant at Duke University Hospital. They found a donor, prepped the surgery, opened her up, and forgot one microscopic detail. The blood type didn't match. The new organs rejected instantly. Her body swelled, her brain shut down, and doctors had to admit they'd literally transplanted the wrong heart. They tried again with a second surgery, but it was too late. The mistake cost a life, and Duke's reputation flatlined overnight. Number 3. Florida, 2024. A man goes in for a routine spleen removal. Simple procedure. In, out, recovery burrito. Except the surgeon took out the wrong organ. He removed the man's liver. By the time anyone noticed, the patient was bleeding out on the table. The doctor said it was an honest mistake. Buddy, there's a difference between missing a parking spot and missing an entire organ. Number 4. Albany, New York. A woman spends 3 years in pain after back surgery. Doctors tell her it's normal healing. Turns out, normal healing included a full-size surgical sponge left inside her. And she wasn't alone. The hospital racked up 7 cases of forgotten souvenirs in just a few years. It's like they thought people wanted party favors after surgery. Number 5. Oregon, 2022. A man's on the table for throat surgery when the oxygen mask fills the air with pure O2. The surgeon doesn't wait for the alcohol to dry, flips on the cauterizer. Boom. His face catches fire. He's literally awake while his own head is burning. If there's a better reason to double-check safety protocols, I haven't heard it. He survived, but he'll never forget the day surgery turned into a barbecue. Number 6. Back in Tennessee, a nurse named Redonda Vaught made the kind of mistake you only make once. She was treating a patient who needed a calming sedative called Versed before an MRI. But instead of grabbing the right vial, she overrode the hospital's med system, typed the wrong name, and pulled out vecuronium, a paralytic that shuts down breathing completely. She injected it. Within minutes, the patient's lungs froze, her heart stopped, and everyone in the room realized this wasn't a sleepy sedative. It was death in a syringe. The woman died, and for the first time in U.S. history, a nurse was criminally charged for a medication mistake. Half the country screamed accountability, the other half yelled scapegoat. Either way, that hospital's new motto should be triple check before you inject. Number 7, California, 2009. Pop icon Michael Jackson couldn't sleep, so his personal doctor decided to give him a little help. The help was propofol, a surgical anesthetic strong enough to knock out an elephant. Dr. Conrad Murray turned a mansion bedroom into a mini operating room with heart monitors, IV drips, and zero common sense. He gave the king of pop a hospital-grade sedative and then left the room. When he came back, Jackson was gone. The world mourned, the trial dragged on, and the verdict was simple. Murray was guilty of involuntary manslaughter. He lost his license, went to jail, and learned the hard way that anesthesia isn't bedtime tea. Number 8, Dallas, Texas. A mother goes in for a simple C-section. Everything seems fine. Baby's healthy, mom's stable, until the nurses notice something weird stitched into her skin. Turns out the doctor had carved his initials into her abdomen, like she was a signature project. He admitted it, said it was an inside joke with himself. The hospital didn't laugh, neither did she. That's not surgery. That's vandalism with a medical degree. Number 9. Louisiana, 2013. A man gets rushed in with chest pain, and the hospital suspects a heart attack. They run tests, but nobody double-checks the paperwork. The lab results come back, but for the wrong patient. So while the real heart attack patient lies in the next room waiting for care, this guy gets loaded with meds he doesn't need and almost dies from them. Meanwhile, the other man actually having the heart attack, he dies waiting for treatment that was meant for someone else. 2 lives, 1 paper mix-up, 0 excuses. Hospitals love to say, "We're only human." Yeah, that's the problem. Number 10. Philadelphia, 1972. A woman named Karen Ann Quinlan stops breathing after a night out. Doctors revive her body, but her brain never wakes up. She's declared brain dead, but her parents believe she's still in there somewhere. The hospital refuses to remove life support. The family sues, the courts explode, and suddenly America's arguing about who gets to decide when someone dies. For 10 years, she stayed hooked to machines that kept her heart going, even after her mind was gone. Her case changed the law forever. It gave families the right to let go when doctors won't. A tragedy born from one medical slip that turned into a decade-long debate about life itself. Still watching? You've officially outlived half these patients. Smash like before number 11 kills your faith in medicine. Number 11, Albany, New York. A woman goes in for surgery. Nothing fancy, just a cleanup job after an injury. A few weeks later, she's in pain so bad it feels like she's got a cactus growing inside her. Her doctor says, "Totally normal, you're healing great." 3 years pass. 3 years. Finally, another hospital scans her and finds it. A full-size surgical sponge, still inside her, molded perfectly to her intestines, like some twisted art project. Turns out, her case wasn't unique. The same hospital had 7 patients with forgotten souvenirs in just a few years. Sponges, forceps, even a piece of wire. They call these never events because they should never, ever happen. But apparently, never means until next week. If you're wondering how someone forgets a towel inside a person, that's a question Albany still can't answer. Number 12. Tennessee, 2018. A newborn comes into the world healthy and screaming until a nurse accidentally gives the baby a dose meant for an adult, 10 times stronger than prescribed. Within minutes, the baby's tiny body goes limp. Doctors rush in, alarms blare, and someone whispers that phrase you never want to hear in a hospital. Wrong chart. The medication was entered under the wrong patient ID. The baby survives, but the nurse loses her license, and the hospital calls it a system issue. Translation: our computers messed up, so a human took the blame. That's corporate medicine in a nutshell. Profits in, accountability out. Number 13. Texas again? This time, a man with cancer goes in for surgery to remove a tumor. Doctors succeed, celebrate, sew him up, and send him home. Months later, he's in agony. A scan reveals the cause: a 10-inch metal retractor still inside his abdomen. 10 inches. That's a ruler and a half of oops. The tool had literally fused with tissue, creating infection and scar tissue around it. When asked how it happened, the surgeon said he didn't notice it missing. Imagine being so casual about a foot-long piece of steel missing from your tray. They had to cut him open again just to remove the bonus part. And yes, he sued. If you think that's a one-off, hundreds of patients every year walk around with hardware they never ordered. Build a body, courtesy of U.S. healthcare. Number 14. Boston, 1942. A young woman comes into a hospital complaining of pain and shortness of breath. Doctors suspect pneumonia and inject her with a new miracle drug, penicillin. Problem is, she's severely allergic, and the hospital knew it. Her allergy note was right there on the chart, written in big red letters. Nobody bothered to read it. Within minutes, she's in anaphylactic shock. They try to save her, but it's too late. Afterward, the head doctor blamed fatigue and said he'd been on call for 36 hours straight. Medicine has advanced a lot since then, but the excuse hasn't changed much. Every mistake sounds smarter when you say it while wearing a lab coat. Number 15. Washington, D.C., 2007. The nation's most famous military hospital, Walter Reed Army Medical Center, was supposed to be a symbol of American pride. Instead, it became a scandal straight out of a horror movie. Reporters discovered moldy walls, rat infestations, broken showers, and wounded veterans living in squalor while waiting months for basic care. Men who'd survived war were dying from infection and neglect just a few miles from the White House. One soldier said, "It felt like they shipped us off to die in peace." Congress held hearings, generals resigned, and America learned that bureaucracy can be just as deadly as bullets. In the end, the hospital shut down. Not because it was poor, but because it was careless. Neglect in uniform is still neglect. Number 16, Los Angeles, 2013. It starts like 100 other ER visits. A worried mom, a teenage daughter with a pounding headache, nausea, blurred vision. The first doctor barely looks up from the chart. "Probably a migraine," he says, like he's reading from a script. No scans, no labs. Just a pill, a pat on the shoulder, and go home and rest. By sunrise, the mom finds her daughter collapsed on the floor, barely breathing. Paramedics rush her back to the same hospital. This time, they finally do the scan. It's a stroke, massive bleeding in the brain. Every warning sign had been there the night before. But the doctor didn't think it was serious. When the hospital got sued, they claimed he followed standard procedure. Yeah, the standard procedure for not listening. The girl survived, technically, but she never walked again. She spent the rest of her life in a wheelchair, trapped inside the kind of story every parent dreads. And when doctors say they're practicing medicine, this is what they mean: still practicing, not perfecting. Number 17, Houston, 2020. A middle-aged man checks in for routine knee surgery, something thousands of people do every day. He jokes with the nurses, gets rolled into the OR, drifts off under anesthesia. Everything's fine, until someone notices the X mark on his right leg, the one they were supposed to operate on. Problem is, the surgeon had flipped the patient the wrong way before cutting. He's halfway through the left leg when a nurse freezes and whispers, "Wait, is this the right side?" By the time they check, it's too late. The healthy leg is gone. The damaged one, the whole reason he came in, is still there, waiting. The hospital panics, lawyers scramble, and the man wakes up missing the wrong limb. They try to justify it with the phrase "wrong site surgery," like it's a clerical error instead of butchery. He eventually loses both legs, one to the knife, one to infection. He came in for a fix and left without a leg to stand on. Literally. And the cause? A flip of the table. Alphabet confusion. That's all it took. Number 18, Seattle, 2018. Heart Transplant Day. The kind of morning that feels like a miracle waiting to happen. The patient's prepped, the donor organ's on ice, and every second counts. Surgeons line up like a pit crew, ready to swap one life for another. Then, mid-procedure, a nurse squints at the blood type chart. The donor's type A, the patient's type O. The colors drain from everyone's faces. They almost transplanted the wrong heart. They stop the surgery seconds before it's irreversible. The patient lives, barely. But the organ, the one that could have saved someone else, is ruined. Later, in the report, the nurse wrote, "I assumed someone else checked it." Assumed. In medicine, that word kills more people than disease. Hospitals run on caffeine, chaos, and assumptions, and none of them cure anything. Number 19, Atlanta, 2015. A 28-year-old woman checks in for a simple tonsillectomy. She's anxious but relieved. Finally, she'll stop getting sore throats. They roll her in, mask on, lights fade, and the anesthesiologist steps out. For just a minute, then another, then 10. And in those 10 minutes, her oxygen line slips loose. No alarms, no one watching the monitor, just a silent room and a dying patient. By the time someone notices, her heart's flatlined. They revive her body, but not her brain. The hospital calls it a communication breakdown. Everyone involved swears they thought someone else was monitoring her. Her parents call it what it is, negligence. 10 minutes of apathy cost her a lifetime. And somewhere in that same hospital, the snack machine's still working, just fine. Number 20, Chicago, 1998. A fit 35-year-old man walks into the ER gripping his chest, sweating, pale, classic textbook heart attack. But the doctor sees his muscles, hears his age, and laughs it off. "You're too young for that, man." Probably just stress. They give him a sedative and tell him to relax. Minutes later, as he's walking out to the parking lot, he drops dead before reaching his car. Autopsy showed a full coronary blockage, a massive heart attack. The doctor's defense? He didn't look like a heart attack patient. Right, because heart attacks only pick people who look the part. Medicine isn't supposed to judge by appearances, but sometimes even a white coat can't fix human arrogance. He died because someone trusted their gut more than the facts, and that's one diagnosis you can't undo. Number 21. Las Vegas, 2021. It's a normal day at the hospital until a nurse grabs the wrong blood bag. The patient's chart says type O, the sticker on the bag says type A. Close enough, right? They hook it up. Minutes later, the patient starts shaking, gasping, her body attacking itself. A massive transfusion reaction. Her blood cells literally explode. Kidneys fail, heart races, body shuts down. They scramble to stop it, but it's too late. She's gone before the shift ends. All because one label, one tiny red letter, was wrong. In Vegas, people lose fortunes on bad bets. But in hospitals, the stakes are higher. Because the house always wins, and the players don't walk away. Number 22. Dallas, Texas, where medical horror stories apparently go to retire. A middle-aged man heads in for spine surgery. His surgeon, known for his confidence, starts operating like he's doing a home renovation. Halfway through, he clips an artery. Blood fills the field. Instead of calling for backup, he decides to fix it himself. Big mistake. He's not a trauma surgeon. He's a spine guy. But his ego tells him otherwise. Minutes later, the patient's blood pressure crashes. When another doctor finally bursts into the room, it's chaos. Too late to save him. And when they check the surgical log later, it says, "Procedure tolerated well." Apparently, well means died quietly. Some surgeons think they're gods. This one couldn't even play mechanic without leaving oil on the floor. Number 23, New York City, 2014. A couple spends years trying for a baby. Appointments, injections, endless tests. Finally, IVF works. 9 months later, they welcome a baby boy. But something's off. Different hair color, different features, even the doctor looks puzzled. DNA tests confirm the nightmare. The clinic mixed up sperm samples. Their child wasn't biologically related to the father, it was another man's. The lab tech accidentally swapped vials during a busy shift and never noticed. When the truth came out, the clinic called it a rare laboratory error. You think? That's not rare, that's catastrophic. They sued quietly, settled quietly, and disappeared from the news. But somewhere out there, another family's raising a kid that looks suspiciously familiar. In America, we call that science. Everywhere else, it's called stealing DNA with gloves on. Number 24. Pittsburgh, 2008. A 69-year-old woman passes away after surgery. Nothing suspicious, nothing messy. Her family asks for an autopsy, closure at least, and the hospital calmly says, "Oh, she's already been cremated." Wait, what? They never signed any cremation papers. Turns out the hospital mixed up the bodies. Their mother was supposed to be autopsied, but instead she got burned. Another woman, a total stranger, got buried under their name. Two families mourning the wrong people because a tag fell off a toe. When confronted, the hospital called it an unfortunate identification error. Unfortunate? That's not a typo. That's the kind of mistake you make when you treat human beings like paperwork. America's best hospitals, folks, where you can lose a loved one twice. Number 25, Washington State, 2022. Routine shoulder surgery. The operating room is calm, music playing, small talk about weekend plans. Then someone smells smoke. They check the cauterizer. Fine. The lights? Fine. Then they look down. The patient's gown is on fire. The alcohol prep they wiped on him hadn't dried before they used the electric tool. Flames race up the sheet like a fuse, singeing his neck and arm. Chaos erupts, doctors screaming, nurses throwing saline, alarms blaring. They put him out, but not before second-degree burns turn his skin into charcoal. He wakes up bandaged from jaw to chest, screaming from a surgery that literally backfired. The hospital called it a freak occurrence. No, freak is when lightning strikes you in a bathtub. This was fire plus oxygen plus laziness, and that equals lawsuit. 25 disasters down. From burned faces to wrong legs, America's healthcare system keeps finding new ways to turn oops into a death sentence. And if you think it can't get any dumber, oh, just wait. Number 26, Detroit, 2016. A nurse prepping a patient for surgery grabs what she thinks is a bag of saline. Clear liquid, standard drip. Hooks it up, sets the rate, walks away. Minutes later, monitors start screaming. The patient's gasping, skin turning blue. Doctors rush in, stop the infusion, and realize the saline was hydrogen peroxide, stored in the exact same bag style. Instead of hydration, the man's veins are filling with bubbles. His organs suffocate from the inside. The nurse faints when she sees the label. The hospital changes the packaging policy the next day. A great idea that would have been even better yesterday. Because no one should ever die from industrial cleaner served IV style. Number 27, Phoenix, 2012. A man finally beats cancer, or so he thinks. Surgeons remove his tumor, close him up, wish him well. A week later, his wife notices his wound leaking black fluid. The doctors call it normal healing. 2 weeks later, he spikes a fever, collapses. Autopsy finds a 6-inch surgical clamp left inside him, rusting against his organs. It had corroded so badly, it was leaking metal toxins into his bloodstream. The surgeon said he didn't notice it missing. Didn't notice? You're not losing a paperclip. It's a foot-long piece of steel. Counting instruments isn't advanced medicine. It's kindergarten math, and this doctor still failed it. Number 28, New Orleans, 1932. America launches one of its darkest medical studies. 600 poor black men in Alabama are promised free health care for what they're told is bad blood. In reality, government doctors are watching untreated syphilis eat them alive. Even when penicillin is discovered as a cure, they keep it secret. Because the experiment must continue. Dozens die. Wives infected. Children born with deformities. And the program runs for 40 years before the truth leaks. When the U.S. finally apologizes, and in the 1990s, only a handful of survivors are still alive to hear it. This wasn't a mistake. It was arrogance wrapped in science. And it remains the dumbest, cruelest study in American history. Number 29, Baltimore, 2017. An organ transplant team is prepping for a kidney surgery. Patient ready, incision marked, donor organ delivered on ice. Then a nurse trying to help stashes the kidney in a nearby freezer. Problem is that freezer isn't for organs, it's for cryosamples, kept at sub-zero temperatures. By the time anyone checks, the kidney's frozen solid. They thaw it, but it's dead tissue now, useless. The patient on the table gets stitched back up, empty-handed, still dying. The hospital's statement? An unfortunate equipment error. Number: you froze a human organ like leftover pizza. That's not equipment failure, that's brain failure. Number 30, San Francisco, 2014. A man goes under for eye surgery. Vision blurry in his right eye. Simple fix. He wakes up and still can't see. Doctors reassure him. Give it time. Swelling will go down weeks later. Nothing. Turns out the surgeon operated on the wrong eye. Perfect incision, flawless work. On the one that wasn't even sick. By the time they fixed the correct eye, the damaged one's permanently blind. The hospital called it a documentation error. Yeah, because nothing says professional like confusing left and right. He walked in half blind and walked out blind twice. Number 31, Chicago, 2019. Hospitals clean their tools between patients. Or at least they're supposed to. At this one, the night crew skipped sterilizing an endoscope, a long camera tube used in colon and throat exams. One night turned into a week turned into 3 months. By the time anyone noticed, 43 patients were infected with a drug-resistant bacteria. When investigators opened the tube, they found slime inside, literal biofilm. The hospital quietly paid settlements and promised improved cleaning protocols. Translation: we remembered soap exists. Imagine getting a colonoscopy and leaving with a new disease. That's not healthcare. That's bioweaponry with insurance billing. Number 32, Florida, 2021. 2 operating rooms, side by side. 2 patients under anesthesia. 1 anesthesiologist bouncing between both. Halfway through, alarms explode, oxygen dropping. He panics, starts CPR on the wrong patient. The sedated man next door gets cracked ribs for no reason, while the real patient flatlines unseen. By the time they realize, one's dead and one's traumatized. All because nobody looked at a wristband. In a sitcom, that's slapstick. In real life, that's a lawsuit that writes itself. Number 33, Washington, D.C., 2007. The Walter Reed Army Medical Center, once the pride of America, becomes its biggest disgrace. Photos leak of wounded veterans living in moldy rooms, rat-infested halls, broken wheelchairs, ignored cries for help. Men who survived Iraq were dying in the capital from infection, neglect, and paperwork. One soldier said, "I lived through war. I didn't think I'd die waiting for an appointment." Congress exploded, generals resigned, and the hospital was eventually shut down. No scalpels, no blood transfusions, just bureaucracy at its deadliest. Because sometimes the worst medical mistake isn't made with a knife. It's made with indifference. 33 medical mistakes. 33 ways to prove that science may be advanced, but humans are still, well, dumb. From frozen organs to fiery faces, America's hospitals have shown us that a lab coat doesn't make you perfect. It just makes your mistakes sound more expensive. So next time you visit the doctor, ask questions, read the labels, and for the love of sanity, make sure they're operating on the right body part. Stay healthy, stay lucky, and maybe double-check your surgeon's resume.